Okay, this is 12-lead ECG. First thing we're going to do is explain the procedure to the patient about what we're going to be doing. We're going to be obtaining a 12-lead from them and looking at their heart. When we want to prepare the patient, if the patient is very hairy, we may want to shave the chest area. Also, if they're having a lot of sweat or very moist for whatever reason, then we'll want to go ahead and dry the patient off, dry their chest off at least. That way we can get all of our electrodes to adhere properly. First thing we'll do is we'll get our electrodes out here. There's a lot of different brands out there, but we'll stick it. First ones we're going to do is our limb leads, and we can separate out the arms from the legs. You've got left arm, left leg, right leg. And you do want these actually out on a limb. You don't want them up on the chest, up on the abdomen. The farther you can get it away, the more accurate it's going to be. So you want to put that on the deltoid there, someplace out actually on the limb. Like I said, left arm, right arm, and then we'll take our leg leads here. And you can either put it down on the ankles or up on the thigh, just somewhere down actually on that lower extremity. And you want to put it on a muscly area. You don't want to put it directly on a bone. It'll get a more interference if you do put it on a bone. Alright, left leg, right leg. So then you'll get your 4-lead will be the first reading that you obtain, and this is what will pop up here on your screen first. Then we're going to go ahead and get our precordial leads out and attach them to the patient's chest after we've already shaved them and prepped the skin appropriately. Alright, we've got V1 here. It's going to go level the 4th intercostal space, and it's going to be just on the right side of the sternum here. About, let's see, right there. Then we'll get V2. And it's going to go 4th intercostal space just on the left side of the sternum. So we've got our sternum right down the middle, and that goes just on either side. You don't want them way out here, or you don't want them, directly over the sternum. We'll take lead V4 here. Make sure your wires are untangled and easy to use. Lead V4 is going to go to the 5th intercostal space, and it's going to go to the mid-clavicular line, and it's typically right below the nipple line. So V4 right there, mid-clavicular. We'll get V3. V3 goes directly between V2 and V4. So right there. And then I like to do V6 next. V6 goes mid-axillary line, and it's also the 5th intercostal space right there in line with V4. But down here, mid-axillary. And then lastly, we do V5, which will go directly between V4 and V6. There, the 5th intercostal space, just directly between them. So once you've got all of them hooked up, you need all 6 of those, and then all 4 limb leads hooked up. You'll want to instruct the patient to sit still, be very quiet, try not to move around at all. Make sure your EKG machine's turned on. Go ahead and make sure everything is plugged in. You do have your 12-lead cables plugged into the limb leads. The precordial and everything is hooked in together. Everything appears attached. You've already done all your attaching of the electrodes to the skin. You'll go ahead and hit 12-lead here. And each machine might be a little bit different. Some of them might have you put in an age or sex of the patient. And then once you do that, it will go ahead and take your 12-lead and print it off. I've got one printed off here for us. This is what it'll look like, kind of the general idea of what it's going to look like. And then based on whatever you're given, you'll also need to be able to interpret that and examine that for any artifact there might be. If we're receiving 60 Hz interference, if there is improper skin prep, that can cause some interference there, and we won't get a good accurate tracing. So we want to look at all that stuff and then interpret the actual 12 lead here. And this is going to be a right bundle branch block, and it is a rate of about, let's see, 300, 150, 100, about 75 or so. Yeah, rate's about 75, and it's going to be a right bundle branch block. And then you're going to want to make sure that you do take repeat 12 leads every 5 to 10 minutes based on the patient's condition and your findings with that.